Have you noticed you're getting up 2 or 3 times a night just to use the bathroom, and you're not even sure when that became your normal? Or maybe it's something subtler, a stream that's weaker than it used to be, a feeling like your bladder never fully empties, a pressure you've been quietly chalking up to getting older and deciding not to think too hard about. I'm Dr. Neraya Wolfe, Urologist and Pelvic Surgeon, and I want to tell you something directly. Those changes are not random. They are not simply the price of getting older. In the vast majority of cases, they are the result of specific, everyday behaviors, things you're doing right now, every single day, that most men have never been told are directly affecting their prostate. Today, I'm going to walk you through exactly what those behaviors are, what they're doing inside your body at the biological level, and, most importantly, what you can do about it. Now, before you say, "I've heard this before," eat your vegetables, don't sit so much, exercise more, I already know. Let me stop you right there. Because there is a significant difference between knowing that lifestyle affects your health and understanding precisely how each of these specific habits is working inside your prostate right now. That clinical understanding is what actually changes behavior. So even if some of what I'm about to share sounds familiar on the surface, I promise you the mechanism behind it is not what you think. Stay with me. By the end of this video, you'll have a clear, honest picture of what your daily habits are doing to this one critical gland, and a concrete path forward. Let's get into it. Before we get into the habits, let me give you just enough context so that everything that follows makes complete sense. The prostate is a small, walnut-shaped gland that sits just below the bladder, surrounding the urethra, the tube that carries urine out of your body. Its primary job is to produce fluid that makes up part of semen. But what makes the prostate particularly important from a urological standpoint is something most men don't realize. It is one of the most behaviorally sensitive organs in the male body. What I mean by that is this: the choices you make every single day, things as ordinary as what you eat for breakfast, how much water you drink, how long you sit at your desk, whether you exercise, all of these quietly shape how your prostate behaves over time. It responds to lifestyle in a way that few other organs do as consistently or as measurably. Now, the prostate also naturally enlarges with age, a condition called benign prostatic hyperplasia, or BPH. And while BPH is common, here's what gets left out of most conversations. Its timing, its severity, and how much it affects your quality of life are genuinely influenced by what you do every day. That's not alarming. That's actually a reason for hope, because it means you have real influence here. Let's talk about exactly what that influence looks like. So let's talk about what actually happens to your prostate when you do certain things every single day. Because I think you might be surprised. Let's start with one of the most common, and honestly, one of the most overlooked factors: sitting. Many of us spend the majority of our waking hours in a chair, at a desk, in a car, on a couch, and prolonged sitting creates sustained pressure directly on the perineal area. That's the region between the base of the scrotum and the anus, which lies right over the prostate. Over time, this chronic pressure can contribute to inflammation of the prostate tissue. It's one of the reasons we see elevated rates of chronic prostatitis in men who work sedentary jobs. The prostate doesn't love being compressed for hours on end. Now let's talk about diet, because this is where the daily choices really add up. A diet that is consistently high in saturated fats, processed red meats, and refined sugars creates a systemic inflammatory environment in the body. Inflammation, as we are learning more and more, is a driver of many prostate problems, from BPH progression to contributing to cancer risk. On the flip side, diets that are rich in vegetables, particularly cruciferous vegetables like broccoli, cauliflower, and Brussels sprouts, contain compounds called isothiocyanates that have demonstrated anti-inflammatory and even anti-tumor properties in research settings. Tomatoes and tomato-based foods contain lycopene, an antioxidant that multiple studies have associated with reduced prostate cancer risk. Zinc, found in seeds like pumpkin seeds and legumes, plays a role in healthy prostate cell function. This isn't to say that eating a salad will cure prostate disease, but the evidence is consistent, and it points in a clear direction. What you eat every day, cumulatively, matters for your prostate. Now I want to talk about something that patients ask me about with real curiosity, and sometimes with real embarrassment, and that is sexual activity. There is actually an interesting body of research looking at ejaculation frequency and prostate health. Some studies have found that men who ejaculate more frequently, whether through partnered sex or through masturbation, may have a modestly reduced risk of developing prostate cancer later in life. The theory is that regular ejaculation may help clear the prostate of potentially harmful cellular byproducts. The data is observational, so we have to interpret it carefully. This is not a prescription, but it's a good example of how daily behaviors that we might not think of as medical are genuinely connected to organ health. Let's talk about alcohol and caffeine. Both are diuretics. They increase urine output. For a man whose prostate is already pressing on the urethra, regular heavy alcohol or caffeine consumption can worsen urinary symptoms significantly. That feeling of needing to rush to the bathroom frequently, the interrupted sleep to urinate through the night, these can all be amplified by what you're drinking every day. And then there's smoking. I say this plainly and without judgment, because I think you deserve honesty. Smoking has been linked in multiple studies to more aggressive prostate cancer. It appears to affect both the biology of the cancer itself and the body's immune response to it. If you smoke, this is one more compelling reason to get support in stopping. Finally, and this might be the most underappreciated factor, chronic stress. When the body exists in a sustained state of stress, it produces elevated levels of cortisol. Chronically elevated cortisol suppresses immune function, promotes inflammation, and can disrupt hormonal balance, including testosterone, which plays a role in prostate cell regulation. Men under long-term stress are not just tired. Their bodies are working under a physiological burden that touches every organ, including the prostate. So what are the symptoms that tell you something may be off? The most common signs of prostate trouble include a weak or interrupted urine stream, the feeling that your bladder doesn't fully empty, a frequent urge to urinate, especially at night, a sensation of urgency that's hard to control, or in some cases, blood in the urine or semen. Pain in the pelvic region, lower back, or hips can also indicate prostatitis. Now, and I want to say this very directly, none of these symptoms automatically mean something serious is happening, but every single one of them is worth talking to your doctor about. Early conversation leads to early clarity, and early clarity leads to better outcomes across the board. So what do you do with all of this information? Let's talk about the practical side. If you're concerned about your prostate, the most important first step is establishing care with a doctor who you trust, ideally a urologist who can conduct a thorough evaluation. This typically involves a conversation about your symptoms, a physical examination, and some baseline testing. The PSA test, prostate-specific antigen, is a blood test that measures the level of a protein produced by the prostate. Elevated PSA levels can be associated with BPH, prostatitis, or prostate cancer. I want to be honest with you, PSA is not a perfect test. It has both false positives and false negatives, and the decision to test should be made in collaboration with your doctor based on your age, your family history, and your personal risk factors. Men with a father or brother who had prostate cancer have a meaningfully higher risk themselves, and that history should always be shared with your physician. Now let's talk about what you can do starting today, because this is the part I truly care about. Move your body. Regular aerobic exercise, walking, swimming, cycling, whatever you will actually do consistently, improves blood flow, reduces systemic inflammation, and has been associated in research with lower risk of aggressive prostate disease. Resistance training supports healthy testosterone levels. 30 minutes most days is not a high bar, and the benefits extend well beyond the prostate. Reconsider your sitting patterns. If your work requires long periods at a desk, build in regular standing breaks. Some men who deal with chronic prostatitis find that specialized cushions designed to relieve perineal pressure make a real difference in their day-to-day comfort. These are small changes with meaningful impact. Hydrate appropriately. I know this sounds counterintuitive when urinary urgency is already a problem, but dehydration actually concentrates the urine and irritates the bladder and prostate. Aim for adequate hydration throughout the day, and then reduce fluids in the 2 hours before sleep to minimize nighttime disruption. Work with your diet. You don't need a dramatic overhaul. Add more vegetables. Reduce processed and high-fat meats. Incorporate tomatoes, leafy greens, legumes, and nuts where you can. These are not just good for your prostate. They are good for your heart, your blood pressure, your longevity. If medications are appropriate for your situation, and for many men with BPH or prostatitis, they are, your urologist can guide you through what's available. Alpha blockers can help relax the muscles of the prostate and bladder neck to improve urine flow. 5-alpha reductase inhibitors can actually reduce prostate size over time. For prostatitis, antibiotics may be indicated depending on the type. These are conversations to have with your doctor, not decisions to make based on what you read online. And please, don't self-diagnose and don't self-treat with supplements or remedies whose evidence base is unclear. The supplement market for prostate health is enormous and largely unregulated. Some ingredients like saw palmetto have been studied and show modest benefit in certain cases. Many others have little to no data. A urologist can help you sort through what's worth considering. Before we close, I want to say something that I genuinely mean. There is a certain kind of courage in taking care of yourself quietly before there's an emergency, in asking the questions that feel uncomfortable, in paying attention to the small signals your body sends before they become loud ones. The men who come to see me after years of ignoring symptoms, not because they were careless, but because they were busy or embarrassed or just didn't think it was urgent enough, they are often the ones I worry about most. Not because it's too late. Most of the time it isn't. But because those years of silence meant years of unnecessary discomfort, and often a harder road back. Your prostate is a small organ, but it is connected to your comfort, your sleep, your relationships, and your sense of yourself. It deserves attention. You deserve attention. So here is your one takeaway for today. If something has been nagging at you, a change in your bathroom routine, a symptom you've been brushing aside, a quiet concern you haven't voiced to anyone, let this video be the nudge. Make the appointment. Have the conversation. Ask the question you've been holding back. Because every day that you choose to understand your body better, you are choosing a longer, healthier, more comfortable life. And that choice is always available to you. If this video was helpful, and I genuinely hope it was, please hit the like button below. It's a small thing on your end, but it makes a real difference in helping other men find this information when they need it most. And if you're not subscribed yet, I'd love to have you here. I put out new videos every week on exactly these kinds of topics. The clinical conversations that don't always happen in a 10-minute appointment. If you want to go deeper, I've covered PSA testing, erectile health, and testosterone in other videos on this channel. I'll put the most relevant one right here for you. Take care of yourself, because you are absolutely worth it.